I want to take some time to talk about trauma. What is trauma? I'm just going to read a little bit from my book here. Trauma describes experiences or situations that are emotionally painful, distressing, and overwhelm a person's ability to cope. This can result in feelings of powerlessness and confusion. The person's neurobiology has been changed such that their ability to attend and respond to the events of everyday life is compromised. Trauma can be defined as a watershed event, an event that divides one life into before and after. It rocks a person's foundation. And when this happens, we refer to the person as having been traumatized. The treatment for a person that's traumatized is different for a person that's distressed but not traumatized. There are neurobiological signatures that occur with trauma, and there are changes that occur with trauma. I'm going to momentarily talk about the types of changes that we see in adults, and then I'll talk about how it's a little bit different with the types of changes we see with children. So, in the days of the caveman, if a bear is about to jump on you, one needs the stress hormones up because it helps you to run or fight. One needs their autonomic nervous system revved up because it helps them run or fight. One does not need their higher brain functions. A lot of parts of the brain shut down, but there's some more primitive parts of the brain that light up more, making a person hypervigilant. Is it safe? Is it safe? Is it safe? This helps a person stay alive and is important during a crisis. Now, if these neurobiological changes take place and don't settle, we may call them acute stress disorder after a while, and if they continue to not settle, then we tend to refer to them as post-traumatic stress, or PTSD. With children, they're not able to fight or flee, and so in children, there's often a second kind of PTSD that develops. It's called a dissociative type, where children basically shut down. And we can see this on brain imaging studies. Dr. Ruth Lanius has done some fabulous research in this area, showing how the brains of adults partially shut down, but the brains of children can shut down more in response to trauma. How is trauma treated? Well, there's a great deal of research in this area, and therapists require an enormous amount of knowledge in this area. I want to also add that child therapists require even more knowledge than therapists that treat adults. There's an enormous amount to know, and more than can be covered in an hour or two or three. It is possible to treat trauma. It's important to find therapists that have specific knowledge in trauma treatment and are trained to work with the specific ages of people that they work with. I think it's critically important that we nip these behaviors in the bud before they become problematic. I have worked with adults who did not receive therapy as children, and where they have continued to act out sexually. No child wants to grow up to become a sex offender, and most of these children, even without treatment, won't. It's prudent for parents and caregivers to educate themselves, to find a therapist that they feel confident with, and to ask many, many questions, and to expect their questions to be answered. Thank you very much, and have a good day.